We are doing another podcast today. This podcast is one of a series that we're doing to support our customers and the wider community to rise to the challenge of the COVID-19 outbreak. Today, I'm very lucky to have Robert Courtine with me, who's going to be talking about ways that you can support your staff. Robert, would you like to introduce yourself?
Yes, thanks, Caroline. My name is Robert Courtine. I have various backgrounds, but principally I'm a mental health nurse and have been so for many years. And I really want just to share a few thoughts about helping people to deal with the anxiety and the stress that has arisen really as a result of having to deal with this new disease that we're having to face, COVID-19.
And obviously, we need to make sure that our workforce is as strong as it can be, because many people are balancing childcare problems, sickness at home, with staff shortages at work. So, a very difficult time. So, what are the main topics you're going to cover for us, Robert?
So I really wanted just to acknowledge the fact that stress and anxiety are normal emotions that everyone experiences. I think at the moment that people are very scared about showing their emotions around COVID-19, believing that they have to try and find ways to deal with it without really acknowledging the fact that they're quite fearful about it. And it's almost as if people are trying to sort of forget the fear factor and forget the anxiety in the hope that it might all go away. And I really want to help people acknowledge that and just to try and think of some practical ways that people might deal with some of those fears.
And it's quite a challenge, isn't it, from the point of view that a lot of the clients that we work with also are acutely aware or feel the anxiety that the staff bring, particularly when we're working with clients with dementia or autism. They have a much more of an awareness, around how staff are feeling. So it's particularly challenging with some of the client groups that we're working with, because a lot of people are very sensitive to the mood of staff. So how can we help staff to be calmer in that situation?
That's a really good point that you raised there. I think the thing to acknowledge is the fact that everyone reacts differently to stressful situations, and how you and how staff respond to the outbreak depend on their own background, and the things that make them different from other people and the community support that they have too, really. Clearly, our clients who are older and people with chronic diseases are at higher risk from COVID-19, we know that. And I think that when our staff, when your staff are going into situations, they're very conscious of that. And there's almost a fear that they're either going to pass something on and perhaps maybe even think that they might develop symptoms themselves of COVID-19. And you're right, clients and customers will pick up on that. And we have to try and develop a response whereby we can try to put our own fears to one side, particularly whilst we're administering care and making visits to clients.
So what are some of the strategies that people can use to support their mental health at this time?
Well, I think perhaps the most important thing is to realise that, as I said earlier on, that stress is normal and it's a normal response that we all have to danger and to threats. And without going into all the science of it, we've all got this little bit of our brain called the limbic system, and the limbic system is designed to alert the body to danger and to threat. And particularly in this new situation, it does feel under threat. Now, when that happens, it pushes out, if you like, the rational thinking of the human being, and the thinking that can actually make some sort of logical sense of all this, if there is any logical sense to be made of it, which of course then leads us to take sensible precautions when we're dealing with people. So I think the first strategy really is to acknowledge the fact that the fear and the anxiety that is caused is to some extent irrational, in as much as it is not going to change the situation that we are in any way at all. And the only thing that's going to make a real difference to people and to us is to learn to connect that, if you like, that irrational side of our brain with the rational side, and to think logically about sensible precautions that we need to be taking, both to support clients and to support ourselves, really. I think it's important to be aware of your own responses to stress during this outbreak, really. I've already mentioned the fact that people naturally are fearful and they do worry about their own health and health of their loved ones. I think too, it's important to look out for changes in concentration, perhaps increased use of alcohol or tobacco or maybe other substances, really. And just to be aware that that might happen, and those might be possible indications of maybe a slightly heightened stress, anxiety situation, really.
Do you think, Robert, we're going to be running out of wine instead of toilet roll next?
I think that's a possibility. Really, we could easily be running out of wine rather than toilet roll. And I suppose on that, the serious side of that is that if we do get to the situation where we are using our wine supplies enough that we're running out, then possibly we're using them a little bit too quickly. And of course, the alcohol consumption at higher levels will only increase levels of anxiety and stress and reduce our ability to cope. And emotions such as stress and anxiety do have to be faced. The more we try to push them away, the worse they become, and the harder they hit. So I think for frontline staff, and indeed all staff, really, it's really important to take regular breaks from watching and reading and listening to news stories. Including social media, really, because hearing about the pandemic repeatedly can be upsetting, particularly if you have no one to share those fears and worries with. And we do know that much of the stuff that's been put out on social media, Twitter, Facebook, for example, is not reliable. And I hate the thought of people relying on that sort of information and their fears being fueled, if you like, by unreliable information, even though both Twitter and Facebook have said that they will be putting up warnings when information is clearly unreliable about the outbreak, really. So do take a break from sort of regular media coverage, really. Learn about the symptoms, including sort of physical, symptoms of fatigue and illness and fear and around this that people experience and that you experience, and allow yourself time to process that information, and make sure that you talk to colleagues and share your concerns and have regular informal supervision around your fears and your worries, really. I think it's useful too, maybe, to think about creating some sort of menu of sort of personal self-care activities that you enjoy, such as spending time with friends and family, even though it has to be possibly by things like WhatsApp and virtually. Exercise is really important. There's nothing to stop you going out for regular walks. You may have to do a few zigzags across the road to avoid lots of contact with people, but there's absolutely no reason why you can't go out. That's perfectly safe to go out for walks and take fresh air. Read a book. Get through some of those books that you've not been reading up until now. Practices like yoga and mindfulness and meditation. There's lots of help on YouTube, for example, around meditation and mindfulness, which really helps to keep people in the moment, as it were, without thinking about having to worry about fears over which they have no control, and maybe a future that they have no control over. Sleep, regular sleep, get plenty of sleep. Enough sleep so your body's able to sort of recharge its batteries, as it were, and process some of that fear, some of those worries. Eating, try to eat as healthily as you possibly can to boost your immune system. if you can get hold of them, fresh vegetables, fresh fruit, not quite so much of the tin stuff and the stodgy carbohydrate stuff, which actually will make you feel quite sort of sluggish and slow you down and dull your sort of alertness really.
Sorry, Robert, I was just thinking, and it is important to say, care and support staff, you rock, because actually
Absolutely.
the commitment that people have to make, and the difficulties they have to manage with their family, it's significant. And it's interesting how Boris Johnson considers people to be unskilled, yet it's the unskilled people that are saving the nation at the moment and
Absolutely.
balancing a lot of those priorities. And I know that people are going to be leaving social care right now in their droves because it's too much. So I think these top tips around how we can look after ourselves so that we can continue to provide these frontline services are really, really critical right now.
They are. They are. Um, I mean, you're absolutely right. The frontline staff, care support staff, health staff, social care staff, absolutely critical. And indeed, as you well say, doing an absolutely fantastic job and do need all our support. And that means helping them to look after themselves too, and giving them the opportunity to look after themselves and to take a break and to feel that support really. And as I said earlier on, I think it's so important for staff to say, yes, of course, we're doing a really important job. And of course, we are going to hail you as heroes. But at the same time, don't feel under such pressure to be heroes that you find that you're making yourself unwell. And
Good
that
point.
if you really feel that you cannot cope and that you're just in a position where things are getting too much for you, the first thing you should be doing, of course, is speaking to your manager or or a close friend. But don't just sit on your worries and your anxieties. Make sure that you share that and tell somebody, because otherwise it's difficult to support you if you don't know what the problems are.
Yeah, and I think, well, all of us that work here at Social Care have worked frontline at some point, and we all know how important it is and how difficult it is actually to be at work when you're not in a good mental state and the impact of
Yeah,
that. So
absolutely.
all really good stuff. And just to say, before we draw it to a close, that we do have lots of bespoke training available around how you can support your staff and mental health training more broadly, because we mustn't forget in all of this panic where we're trying to protect people's physical well-being, actually we are in many situations sacrificing people's mental well-being, and there needs to be a really good focus on that. And just before we go, Robert, is there anything you want to add?
I think the thing I would want to add is, please, as much as we value you, we value you not only for the work that you're doing, but we also value your physical and your mental health too. And it's important that we can support you in that as much as we possibly can. And as Caroline says, there's lots of information available, and hopefully we can produce lots more information to help you in that support. But please look after yourselves, and please don't hesitate to tell somebody if you feel that you're struggling in any way at all, because in doing that, we can get you the necessary support that you might need.
Brilliant. Thank you very much, Robert. I've really enjoyed talking to you today. It's been fantastic. I'm going to just say goodbye now.
Okay, so thanks, Caroline, very much, and watch this space for more information.